We had discussed about hypothyroidism. As we discussed about signs and symptoms, causes of hypothyroidism. Usually, the patient walks in with fall of hair, constipation, becoming weak. Sometimes menses become irregular, weight gain. So these are the signs and symptoms. If you find in any patient, one should look for hypothyroidism. One should go for very common tests T3, T4, and TSH. We had also discussed about the causes. Coming to the final part on hypothyroidism, today we are going to discuss about lifestyle changes and complications. A healthy lifestyle, which is a regular exercise. After age 50, one should walk for 4 kilometers to going to coming. One should increase the kilometers very slowly. Then a healthy diet, a balanced, good diet, which is very rich in fruits and vegetables. Particularly, one should avoid flour and cabbage. Stress management and adequate sleep are also two very important aspect of lifestyle changes. One should check the diet also. As I said, one should take more of fruits and vegetables, whole grain, and adequate iodine. Iodine is a must. We get enough iodine in the salt. If you take a standard salt of any company, all will have iodine. The problem only occurs when many people try to take that Sindhu salt. There's nothing wrong in taking Sindhu salt, but make sure that on the package you see that there is iodine given to the person. Treatment, as we had discussed before, is very simple. You have to replace with the thyroid hormone. Simple. The body is not producing thyroxine, so you give thyroxine from outside. Once the person will get an adequate dosage, there will be a seesaw change in the person. Coming to the complications, hypothyroidism may lead to high cholesterol. Triglyceride is one thing which is found very high in many patients with hypothyroidism. Unless you control the thyroid, that triglyceride level will not come to normal. So that's a must. It can lead to heart disease, high blood pressure. Depression is one of the major complications. Severe fatigue. Usually, many times, if the person has thyroid, one can see enlargement of the thyroid gland, which is known as goiter. Goiter does not mean patient has hypo or hyper. He or she can have any one of them. Ultrasound is also a good test if one is thinking about tumor or any other disease of the thyroid hormone. So coming to a conclusion about hypothyroidism, it is very simple. The body is not producing thyroid. You must replace the thyroid. You give thyroid from outside in adequate doses. It will give you excellent results. Thank you.